So welcome viewers, you are welcome to the Sipher Health News. This special edition will be released during this National Eye Donation Fortnight 2022. The National Eye Donation Fortnight is observed every year from 25th of August to 8th September. And it is a campaign which aims to create mass public awareness about the importance of the eye donation and to motivate people to pledge their eyes for donation after death. Blindness is one of the major public health problems in the developing countries, especially India. According to the World Health Organization, corneal diseases, that is damage to the tissue which covers the front of the eye, which is called as cornea, they are among the major causes of vision loss and blindness after cataract and glaucoma. So in India, approximately 68 lakh people, they suffer from corneal blindness in at least one of the eyes. And of these, 10 lakh people, they are blind in both their eyes. The National Blindness and Visual Impairment Survey 2019, it reported that corneal blindness was the leading cause of blindness among the patients aged less than 50 years in India, accounting for 37.5% of the cases, and was the second leading cause of blindness among patients above the age of 50 years. And in most of the cases, loss of sight can be corrected through eye donation by donating eyes after death. A corneal blind person can see again through a surgical procedure which is known as corneal transplantation, where the damaged cornea is replaced by a healthy cornea from the eye donor. And this link for the online donation, it is there in our slide. So you can always pledge your eyes by clicking at the link. So next, please. So we are the host, Dr. Rakesh Gupta. I am a president of Sipher and former Director Health Services Punjab. And I have with me Professor Sonu Goyal. He is in Department of Community Medicine, School of Public Health, Chandigarh. And we welcome Dr. Sanjiv Kumar for this special informal interview, which is going to be released during the National Eye Donation Fortnight. So you are welcome, Dr. Sanjiv.
Thank you.
So Professor Goyal, you can continue further.
So we are privileged to have with us Dr. Sanjiv Kumar, who is the chairman of 3Domain Leadership Foundation, which he has founded a couple of years back. He was an alumnus of AIIMS with 46 years of experience in public health and has visited 33 countries across globe. He worked in public health, which expands from deserts of Rajasthan, Masai villages of Kenya, former Soviet countries in transition, conflict-torn areas of Iraq, Somalia, Tajikistan, and Uganda. He started his career as a medical officer in Indian Army and then worked extensively at the grassroots level in primary healthcare center in Haryana and urban slums in Delhi. He taught preventive and social medicine as lecturer in University College of Medical Sciences, New Delhi, which is a premier institute in our country. And he thereafter joined UNICEF and worked for 22 years as health specialist in India and as a chief of child survival and development and senior advisor in various countries, including Iraq, Kenya, Uganda, and Somalia, and also serving as a regional advisor for 22 countries in Central Asia, Central and Eastern Europe, and Baltic states. In the course of gaining a vast experience, Dr. Sanjiv Kumar has published over 100 papers in scientific and popular magazines and chapters in the book, and his current focus is on leadership and strategic management in health and health research. And I am fortunate to be a part of few papers which we jointly wrote in various journals. Dr. Gupta, can you do the next one?
So you are welcome, sir, for this informal interview for Sipher Health News. And we will be sharing this interview, this video, the recording of the video with all the public health specialists, especially the young students, so who will be motivated by your talk. So, sir, I will like to ask you about your education and journey as a public health specialist, and what factors actually influenced your choice for this profession?
Thank you, Dr. Rakesh Gupta. It is always and also a pleasure to associate with activities led by Dr. Sonu Goyal. And it's a pleasure, and thanks to you for giving me this honor. My journey of 46 years is essentially divided into 4 phases. Phase 1 is the formative years, from 1971 when I joined MBBS at All India Institute of Medical Sciences. And it continued during my army, where I got first-hand experience that prevention is not only better, but also cost-effective and also more, contributing to health than treatment. So that was my army phase. Then I came back to do my MD at Center for Community Medicine in Preventive and Social Medicine, and I did senior residency at AIIMS. And then I would say that I moved on to the next phase, which was I can call it the practicing phase. I practice what I learned in preventive and social medicine. And keep in mind that I'm not saying public health, I'm saying preventive and social medicine, which is much bigger than public health and much more effective than public health. So preventive and social medicine, I practiced for almost 23 years, starting in 1988 in UNICEF in Rajasthan, then moved international. And I took premature retirement. I was missing home to come back to India. So that was essentially practicing phase. In this phase, I was able to put into practice what I learned in my formative years in preventive and social medicine. But it also gave me an opportunity to learn from health systems across more than 30 countries. Each country is different from the other. And in India is like a continent, each state is different from other. So you learn, provided you're open to learning. And many times we get into the attitude, I know everything. What is there for me to learn? So that attitude to learning has to be there. But that phase actually was very important in my career for learning preventive and social medicine. And then the third phase is academic phase, there for me to learn. So that attitude to learning has to be there. But that phase actually was very important in my career for learning preventive and social medicine. And then the third phase is academic phase. As lecturer, preventive and social medicine in US, UCM, known as Director AIIMS. So that brought me back to academics. Academics has an advantage that when you teach something, you go deeper into it. You can't teach it unless you have the good understanding of the background and what is being discussed. And my understanding from my experience in academics is you read 10 times more than what you present in your classes. The fourth phase is the most satisfying phase, that is policy making and experience sharing phase. So in this phase, I worked as Executive Director of NHSRC, Dr. Rakesh, and I was responsible for developing guidelines, protocols, treatment protocols for clinical conditions. And the most important contribution was National Health Policy 2017, which was written by NHSRC. And NHSRC was then on the parallel experience sharing, capacity building. Dr. Rakesh, you and Dr. Sonu Goyal, you have involved me in many in-service training, and that is again, I would say, very satisfying part. So essentially, these 4 phases of my education and experience in preventive and social.
So excellent, sir. Thanks a lot for sharing your rich experience. So as a student and then as a professional, so as an academician. So, sir, I'm sure that all the public health specialists who are our viewers, they will benefit from your experience. So thank you, sir. And Dr. Sonu, you can just continue.
Sir, I think very nicely you have told few things which are really, really important for our youngsters and young budding public health experts. And I really like your approach whenever I meet you. So I think that open to learning approach is very relevant, and people like us, and when we become seniors, so we close our mind and we are not open to learning. And I always believe, like you, that we learn from each other, we learn from our juniors, we learn from our health workers who are there posted. And the second thing is, you have risen from the bottommost level. As a medical officer, you work there, you learn the practices, and then you worked at the policy level, because then you come to know about the real gaps in the field. So for youngsters, I think they should not jump directly to the level of policymakers, because that when you work at the ground level, you know the realities, and then you go at the higher level to practice those realities. So I think wonderful, sir. So next thing I just want to ask you, sir, you are considered among our fraternity and globally as well as one of the most senior public health experts. So what do you think, as a public health practitioner, as a policymaker, as an implementer, as an academia? So what are the major public health tasks which are there in our hand right now in India?
Thanks, Dr. Sonu Goyal. I will focus only on one area, because if we continue to talk about various public health issues, we can spend a whole session on this. I will focus only on non-communicable diseases.
Right.
You know, our health, most other developing countries has started from controlling communicable diseases and maternal child health issues. You know, recently we had health and wellness centers 3-4 years back, and we have now started incorporating non-communicable diseases. So I will focus on, when you are addressing non-communicable diseases, what should be our approach. I essentially again feel there are 4 major areas. We need to reorient. You know, first area is lifestyle. Though lifestyle is important also for communicable diseases and maternal child health, but it is even more important when it comes to non-communicable diseases. So all practitioners of public health, clinicians, and health systems at central and state level need to start focusing on lifestyle. We are so used to giving pharmaceutical intervention that we often confine non-pharmaceutical intervention to either verbal communication, never enters prescription. But when you are addressing non-communicable diseases, lifestyle changes are more important than pharmaceutical intervention. I often come across people who say, I was diabetic, I did this and that, and I stopped taking medicine. They forget that medicine is only one part of treatment of diabetes. If you focus on non-pharmaceutical intervention, you are addressing diabetes. And even if you are taking medicine, lifestyle related interventions, diet, physical activity, consumption of tobacco, non-consumption of alcohol, etc., must continue. And my suggestion is that you start addressing lifestyle related issues in the childhood. Second area which needs reorientation is long-term intervention. Non-communicable diseases, diabetes, hypertension, cancers, etc. They need long-term intervention, not like communicable diseases that you had COVID and you were treated for 1 week or 2 weeks, and then you were sent home. And for other infectious diseases, you're given a course of antibiotic, and there may be some chronic diseases like tuberculosis, which may take longer treatment. But in non-communicable diseases, we need to address on long-term interventions. It's a long drawn-out battle. Many times, for rest of your life, you have to handle these conditions. And then you were sent home. And for other infectious diseases, you're given a course of antibiotic, and there may be some chronic diseases like tuberculosis, which may take longer treatment. But in non-communicable diseases, we need to address on long-term interventions. It's a long drawn-out battle. Many times, for rest of your life, you have to handle these conditions. The third point I mention is whole of population approach. everyone needs to be addressed when it comes to non-communicable diseases. Those who do not have disease, lifestyle changes तो उनमें भी जरूरी हैं. तो आप शुरू से बीमारी होने से पहले, रिस्क फैक्टर आने से पहले ही अपना लाइफस्टाइल जो है वो हेल्दी लाइफस्टाइल बनाएं. It will help you in non-communicable diseases, but it also increases your immunity to communicable diseases and various other health issues. When you have risk factors, you give intensive lifestyle changes, intervention. Do not know they have the disease. You know, they always say that you have 2 times more diabetics than they are known to be in a population. So for that, you need the screening, pick up conditions early. When you have symptoms, go to the doctor, get tested, and you may be suffering from diabetes or hypertension. And the fourth one is those with the disease. Your job is not over once you are diagnosed. You will continue with lifestyle interventions. You will also continue to follow up, because with diabetes, hypertension, you have complications. तो उनके लिए भी आपको स्क्रीनिंग करना पड़ेगा कि रेटिनोपैथी तो नहीं हो रही, किडनी के ऊपर असर तो नहीं आ रहा. तो all those things will continue. So this is how we need to address, and every one of us needs to be reoriented to this. Fourth one is when we look at non-communicable diseases. हमारी जो traditional teaching Dr. Rakesh Gupta, Dr. Sonu Goyal is हम compartmentalize maternal child health, gynae की class अलग होगी, pediatrics की class अलग होगी, infectious diseases की class अलग होगी, non-communicable diseases की class अलग होगी. But in real world there is an overlap. You know, when we had COVID, we had higher mortality in diabetics, in hypertensive, those with heart disease and other non-communicable diseases. We use a term in epidemiology called syndemic. एक epidemic already था, non-communicable, उसके ऊपर COVID और आ गया. तो जो non-communicable diseases wale the, unki probability of infection is higher. If they get infected, probability of adverse outcome, including death, is higher. They are more likely to go to ICU. They are more likely to go to hospital. So in the real world, you cannot compartmentalize non-communicable diseases, infectious diseases. For example, gestational diabetes. आप maternal health कर रहे हो, gynecologist पर उसको diabetes भी तो हो सकती है. Only may be induced by pregnancy. And this woman who was having gestational diabetes is more likely to be diabetic in later life. डिलीवरी के बाद हो सकता है ब्लड शुगर नॉर्मल आ जाए, पर उसको बाद में डायबिटीज होने की संभावना देखिए. उसी तरह हाइपरटेंशन इन प्रेगनेंसी. So no, we need to look at these 4 areas. So one is lifestyle, second is long term, third is whole of population approach, and the fourth one is non-communicable diseases are not a separate compartment. It is not a separate silo. You need to look at it when you're looking at infection, maternal child health, and so on. So thank you, Dr. Sonu. Very important question.
No, I think very well replied, sir. I think you have very clearly delineated those approaches which are very much required by our government of India. And I always add to this thing that whole of the government approach sometimes, like when we are moving in, so only we think that only health department is responsible for all the things. It's not only the health department, the education department, which you have told that right from the beginning, they should be educated about these things and about our enforcement department, our excise taxation. All these things should work in health. So whenever they are making their own plan, so health should be there in all. Health component should be there in all, and you have advocated about health in all concept wherever you are talking about it. So I think that is one of the things.
I'm glad you raised this point. It's more important for non-communicable diseases, but when you look at how much health is contributed by various sectors, including departments and ministries of health, it is only 10% contribution of ministries of health and departments of health, all health centers, all hospitals put together. 80 to 90% of health from water, sanitation, education, agriculture, industries, highways, the accidents on the streets will have. So we need for that health in all policies, which is very important. whole of government approach and the whole of society approach.
Yes.
In COVID time, we saw whole of society approach. It was very effective. Everybody was concerned. Everybody was taking action. Very important point. Thanks for raising that.
No, I think wonderfully, and I think the audience who are listening, the public health practitioner, they can work on either of them. I think improving the health system, incorporating health in all. So I think they should learn from here, and all those policymakers who are listening from different parts of the country and even globally will be benefited with these 4 or 5 criteria, how to address this NCD in their own states, jurisdiction, or their countries. Over to Dr. Rakesh.
So thank you, sir. And I think you have very precisely told us how to reduce the NCD burden. And as you know, me and Dr. Sonu Goyal, we are focusing on tobacco control also. And I think the National Tobacco Control Program is a very good example of integration of involvement of all the stakeholder departments and integration of other national health programs also. So you have rightly said that these NCDs, they need to be prevented, and they need to be, even the kids, they need to be told about how to prevent these diseases. So thank you, sir. And sir, now I'll like you to share your experience as director of very premier institutes like IHMR Delhi, so that we can gain from that experience also as an administrator.
Thank you, Dr. Rakesh Gupta. In my life, consider 2 jobs I got as my first working in preventive and social medicine or public health. First dream job was when I joined UNICEF. I joined UNICEF as project officer immunization and kept on moving up, and the area got expanded to include maternal, child health, child survival and development and so on. And as a public health person, you always look at, you are better placed than a clinician, that immunization coverage, for example, when I joined Rajasthan was 15%. When I left Rajasthan, it was 80% in immunization coverage. For example, when I joined Rajasthan was 15%. When I left Rajasthan, it was 80% in infants. And when we did calculation of at that coverage, 15% coverage, how many children are dying? And at 80%, how many children are saved from dying? So the figure came to around 190 deaths every day because of vaccine preventable diseases. That was the 6 diseases that time. Now you have more. And when I left, it was down to 90. There's still a lot of work was left, because even one preventable death is too many. So, but satisfaction that you were able to reduce deaths because of vaccine preventable diseases and save 100 children every day. The second dream job was when I joined as Executive Director, National Health System. There's still a lot of work was left, because even one preventable death is too many. So, but satisfaction that you were able to reduce deaths because of vaccine preventable diseases and save 100 children every day. The second dream job was when I joined as Executive Director, National Health Systems Resource Center. All your learning, you can put into standard treatment protocols and guidelines. You can support states in making program implementation plan. And those of you who are not aware, these are the state plans which are submitted to the Ministry of Health, and then Ministry of Health releases funds. It comes under National Health Mission. So you're able to handhold the states to include areas like tobacco control. You know, it's a relatively new area. To include areas like climate change, which is contributing to increasing morbidity and mortality, but these areas were not included earlier. So you can handhold the states, and then you can go around all states and union territories in India, pick up the good practices. And then we started the National Summit on Good Practices, and I'm sure Dr. Sonu Goyal, Dr. Rakesh Gupta, you have presented some of the good practices at those National Summit. So states come together, good practices are presented, and those states who like, they get excited. Sir, we want to implement what Rajasthan has done or what Haryana, Punjab has done. And then on the last day, the states include what conditions they want to work on. and continue. National health policy, preparing national health policy is a dream for every public health profession. जीवन में मौका नहीं मिलता हमें. So that national health policy 2017 was another dream assignment on which we worked, and we did exactly what we wanted to do. Health policy में stakeholders involvement होना चाहिए, good situational analysis होना चाहिए, policy राज्य सरकार implement करती हैं उनका involvement होना चाहिए. This was the first policy which had extensive state government involvement. Professional bodies, and Dr. Sonu Goel was there in Lucknow when we had a consultation with IAPSM, Indian Academy of Pediatrics, IMA, IPHA, etc. They all came together to give contribution. Then coming back to academics. In academics, you know, everyone of you is familiar. You have information, you have data, then you have information, then you have information is like छोटे बच्चे को पहाड़ा सिखा दिया, दो देखम दो दो दूनी चार, उसको 5 केले दे दिए, केला 2 रुपए का, कितने का, ही इज लॉस्ट. फिर वो शुरू करता 2 एकम 2 2 दूनी 4 2 दे, वो 10 तक पहुंच जाता है, फिर भूलता है अरे ये तो 5 तक ही करना था. Information is when you are able to say, and you stop at 5, 2 पंजे 10. Then comes to knowledge. You don't have to do pahada. That also comes with experience. And जब 5 केले 10 रुपए के, 10 केले 20 रुपए, no, immediately you're able to. Then comes wisdom. Wisdom comes with experience. There is no shortcut to wisdom. So I was very happy when I went to AIIMS Delhi. I could build on my wisdom. And many of my students, I meet them after 10 years or 5 years. And they say, sir, आपने कहानी सुनाई थी. Based on experience, वो कहानी उनको याद है, पढ़ाया क्या था वो नहीं याद, वो कहानी से lesson क्या थे वो याद है. So, you know, that is another assignment I felt. And same I bring to in-service training courses. Both you, Dr. Rakesh Gupta and Dr. Sonu Goel, invite me to facilitate various sessions, and I built on that experience of 46 years. वो कोई तजिकिस्तान में कोई experience हुआ था, में Uganda में, you know, you are able to immediately reflect. अरे, somebody asks you questions, say हाँ Uganda में ऐसी स्थिति थी, this is what we did, this did not work, everything doesn't work. So we learned from that. So that's my response to your question, Dr. Rakesh Gupta.
You're right, sir. I can also share that they have a very small field, in fact. So you can impact very, but as a public health specialist, you can impact a wider group of people and wider jurisdiction also. And I shared when I came to you in IHMR to share my best practices in Punjab regarding tobacco control. So I knew that you are doing a commendable job as the head of the IHMR. So thanks a lot, sir, for sharing your experience. Yeah. So over to Dr. Sonu.
Sir.
On one more aspect, Dr. Rakesh Gupta, you referred to in your last remark, networking. As a public health professional, as a preventive medicine expert, you cannot work effectively unless you have network.
You're right, sir.
You should know people who are doing exceptionally good work, like Dr. Rakesh Gupta came and delivered a talk, Dr. Sonu Goel came and delivered a talk on change management. You talked about tobacco and related problems. So you have to build your network. You cannot have
You're right.
expertise in it. The expert in that area whom you can call and can contribute to learning or improving program or improving policy. Thanks, Dr. Rakesh Gupta, for sharing that.
Thank you, sir. Thank you.
Sir, yes, sir, you have been known to be one of the best leaders of public health in our country, and you are also imparting various trainings on leadership, right from INCLEN, IHMR, and then we are also inviting you for International Public Health Development Management Program, where I think you have witnessed almost 700 plus participants from 80 plus countries who have come from different countries. Since 2016, you have been a part of this program. So how do you think that leadership is really important for young public health professionals? And what are the various domains or skills which a young public health professional should possess to him or her becoming a successful leader in the country or in the society?
Thank you, Dr. Sonu Goyal. Leadership is one area which I missed most of my life. Leadership was only to be read in newspapers, on books of interest. Sardar Patel ki जीवनी बचपन से पढ़ते रहे हम, Iron Man of India, Subhash Chandra Bose, Pandit Jawaharlal Nehru, Mahatma Gandhi. I also read those biographies, and my father was a very rapid reader, so he always suggested books from his experience, and we used to read that. But in my profession, neither in MBBS nor in MD nor in DNB, maternal child health, I was even to ask a question. There was nothing about leadership in any one of the courses I had undertaken. And I came to know about leadership and its importance when I was regional advisor, running around 22 countries, meeting prime ministers, health ministers, presidents for advocacy, going to WHO General Assembly meeting, promoting certain concepts, and I felt I was incompetent. I talked to my other colleagues and they suggested, why don't you do Masters in Business Administration? I looked around, and at the age of 53, I joined an MBA from University of Wales, UK, and the college was in Zurich in Switzerland. So I did that course. In that course, there was one course on applied leadership. I read a lot because it's an area of my interest. So मैंने 6 किताबें पढ़ी कोर्स में, 6 किताबें पढ़ी और 107 आर्टिकल मेरे को अभी भी याद है. And I was totally confused. Every one of them has a different way of looking at leadership. You can take an excellent class, academic class, but what is in it for me to learn and develop my own leadership skills? It was missing. So as an assignment, I talked to my course director for that particular course. I said, I want to develop my own concept and put it as my assignment for this course. He was very happy. And that involved a lot of work. So then I looked at it and developed what Dr. Sonu Goyal, Dr. Rakesh Gupta are familiar with, 3-domain model. If I want to become a leader, I have to start with myself. I need to have skills which will help me managing myself better, emotional competency, not only for work. इमोशनल कॉम्पिटेंस, बच्चों से भी तो इमोशनल कॉम्पिटेंसीज चाहिए आपको, अपने स्पाउस से भी इमोशनल कॉम्पिटेंसीज चाहिए, अपने फ्रेंड से डील करने के लिए भी इमोशनल कॉम्पिटेंसीज चाहिए. So one is emotional competencies. Second is, I don't call it time management, I call it first thing first. You have only 24 hours. मेरे पास भी 24 घंटे हैं, प्राइम मिनिस्टर नरेंद्र मोदी जी के पास भी 24 घंटे हैं. उन 24 घंटों को मैं कहाँ इस्तेमाल करता हूँ? That is the difference between me and the prime minister. And that is the difference between an average public health professional and a successful public health leader. So you have to set your priorities, and it is not in silos. कि मेरा family commitment तो 6 बजे के बाद शुरू होगा, 10 बजे से 6 बजे तक मेरा office का commitment. It's not in silo. You have to look at 24 hours and look at your priorities. मेरी family priorities क्या हैं, मेरी अपनी priority, and you have to keep revisiting these, क्योंकि समय के साथ साथ आपकी priorities change होती रहती हैं. So that is the second. Third, I feel, is communication skill. As a public health person, अगर आप 1 मिनट में मंत्री जी को, हेल्थ सेक्रेटरी को, सीनियर ब्यूरोक्रेट्स को या टेक्नोक्रेट्स को नहीं बता सकते आप क्या चाहते हो, then you have lost the battle. 1 मिनट में क्या बताना है? सर समस्या ये है, सर अनुभव के आधार पर इस समस्या को इस तरह से डील किया है, 1 जगह 2 जगह, एक देश ने 2 जगह, और हमें ये करना है. ये 3 चीजें आपको 1 मिनट में बतानी है. कम्युनिकेशन स्किल. I have seen many public health professionals in many meetings. वो आते क्रिटिसाइज करना शुरू कर देते हैं. क्रिटिसाइज तो आप किसी को भी कर सकते हो, किसी बढ़िया से बढ़िया प्रोग्राम को भी कर सकते हो. यू हैव टू फोकस ऑन वे फॉरवर्ड. देन पीपल विल लाइक यू। आपको उनने इसलिए बुलाया कि वे फॉरवर्ड बताओ कि आगे सुधार कैसे, गलतियां तो उनको भी मालूम है, अगली मीटिंग में आपको बुलाएंगे ही नहीं अगर आप गलतियों की बात करते रहोगे। एंड दैट विल द एंड। वो फिर मिनिस्ट्री में सब जगह वो फलाने फलाने प्रोफेसर को बुलाया तो वो तो गलतियां ही निकालता है, उसको नहीं बुलाना, उसका नाम काट दो, आपने कहाँ से उसका नाम ले लिया। If you are constructive, focused on way forward based on your extensive knowledge and reading, they will call you. The second domain is teamwork. You are excellent, but you have to make every one of your team members excellent and contribute. Third domain is strategic management. You are looking at future कि अब communicable diseases में ये नई चीजें आ रही हैं, re-emerging diseases आ रही हैं, zoonotic diseases like COVID-19 ये आ रही हैं, इनको attention देने की जरूरत है और उसकी तैयारी अभी करनी है ताकि 5 साल 10 साल बाद आप इनसे डील कर पाओ। Damage has already been. That's in brief. I reading on leadership and the courses I have been facilitating. The 3 domain, मैंने अभी जो संस्था बनाई है 3 domain health leadership foundation, वो इसी 3 domain Gupta familiar. I focus on these 3 domain and I find this approach is very practical. Everybody can relate कि हाँ सर एक domain में मेरे को ये करना है, दूसरे में ये, तीसरे में, and I want to be a leader. तो उनसे 3 महीने 6 महीने बाद पूछते हैं कि हमने क्या किया, then they are able to focus on and move forward. Thank you for.
No, I think very important, sir. These are the 3 key lessons which you have taught to our public health specialist. I think the important thing is the learning from the self and managing self, emotional competence, how to be a good communicator, then focus on teamwork and networking, which you have rightly told. I think these are the second thing, which is again important. And third is not only looking at the present, but at least keep an eye on the future as well, because you never know what lies in the future. And if you start thinking and planning only based upon your current aspects, we may not be able to plan well. So I think futuristic thinking and change management, strategic management. So these things are very important skills which people should learn now. So very important public health skills are you have told. Over to Dr. Rakesh.
Rightly said, sir. I think leadership training is must, especially for all the clinicians who move to the public health, especially when in early times we were clinicians and then we moved to the direct health services and we worked in public health. So we learned by experience. So, but you have told how to actually inculcate the leadership skills in all the public health specialists. So that is very helpful, I think. So, sir, now before concluding this informal interview, I'll ask you to give your message on National Eye Donation Fortnight. So it will be up to 8th.
Thank you, Dr. Rakesh. Yes, तो 25 अगस्त से 8 सितंबर तक हम हर साल आई डोनेशन फोर्टनाइट मनाते हैं. I will not go into blindness. I will only focus on the corneal blindness, which is directly related to eye donation. And Dr. Rakesh in the beginning gave us figures on that. I will also only re-emphasize a few of the figures he gave. There are 68 lakhs, 6.8 million people suffering from corneal blindness in India. Vast majority, around 60 lakhs, are suffering from one eye, and around 10 lakhs are suffering from both eyes.
Both eyes.
In under 50, as Dr. Rakesh Gupta, is number 1 cause of blindness. क्योंकि हम कैटरैक्ट नहीं देखते 50 साल से कम आयु में. 50 साल की बाद की आयु में नंबर 2 कॉज है, क्योंकि तब कैटरैक्ट पहला कारण बन सकता है. हम एक साल में कितने कॉर्नियल ब्लाइंडनेस के ऑपरेट करते हैं? लगभग 40,000. और कोविड के टाइम पे तो कम रह गए थे, क्योंकि अस्पताल ही बंद हो गए थे. रूटीन सर्विसेज, बेचारा कोई हार्ट अटैक से मर गया, किसी के बच्चा डिलीवर हुआ, सड़क पे डिलीवर हुआ, अस्पताल में वार्ड ही बंद कर दिए उन लोगों ने. तो वी सफर्ड, एंड दैट्स अ लेसन फॉर ऑल ऑफ यू दैट व्हेन यू हैव पब्लिक हेल्थ क्राइसिस लाइक कोविड-19, routine services, regular services must continue. Otherwise you will have, all cause mortality देखते हैं ना, क्योंकि कोविड के दौरान हार्ट अटैक का इलाज नहीं हुआ, डायबिटिक हाइपरकीटोसिस का इलाज नहीं हुआ, हाइपरटेंसिव क्राइसिस का इलाज नहीं हुआ, लोग मर गए. They did not die of COVID, but when you look at all-cause mortality, they died because COVID had disabled the whole system. Either they got scared or the hospital did not take them. एक बहुत इम्पॉर्टेंट एस्पेक्ट हमें ध्यान रखना है. हम यूनिवर्सल हेल्थ केयर की आजकल बहुत बात करते हैं. मेरी सोच ये है कि कैशलेस हेल्थ केयर मिलनी चाहिए, चाहे वो NHA से मिले, आयुष्मान भारत से मिले, प्राइवेट इंश्योरेंस से मिले. गवर्नमेंट का एफर्ट होना चाहिए हर एक नागरिक को, चाहे वो अपनी तरफ से इंश्योरेंस कंट्रीब्यूट कर रहा है या उसका ऑफिस कंट्रीब्यूट कर रहा है या भारत सरकार कर रही है, हर एक नागरिक को केयर मिलनी चाहिए. कॉर्नियल ओपेसिटी है, उसको पैसे का हिसाब नहीं लगाना, उसको तो सिर्फ अस्पताल में जाके बोलना मेरे को पैसा नहीं देना. हो सकता है कि मेरी जो कैशलेस केयर है वो 90% जहां से मैंने इंश्योरेंस लिया वहां से आएगी, 10% मुझे बाद में देनी पड़ेगी, पर वो अस्पताल में घुसते ही नहीं मांगे. उसी तरह इमरजेंसी केयर, नहीं तो हमें सबको, आपको और मुझे भी देखना पड़ता है मेरी जेब में कितने पैसे हैं, कितना क्रेडिट कार्ड में लिमिट है, ताकि मैं अस्पताल जाऊं तो वो इलाज हो सके. ब्लाइंडनेस की एक बहुत आवश्यक इंटरवेंशन है, वो पूरे यूनिवर्सल हेल्थ कवरेज के लिए होनी चाहिए कैशलेस के. दूसरा जो मुद्दा है ये भी पॉलिसी लेवल का मुद्दा है. 75% कॉर्नियल ट्रांसप्लांट प्राइवेट सेक्टर में होते हैं और ये प्रतिशत बढ़कर को मेन स्ट्रीम करना पड़ेगा प्रिवेंशन ऑफ ब्लाइंडनेस प्रोग्राम में. जो सुविधाएं सरकारी संस्थाओं को मिल रही हैं वही सुविधाएं प्राइवेट सेक्टर को मिलनी चाहिए, क्योंकि समय के साथ साथ प्राइवेट सेक्टर और ज्यादा इंपॉर्टेंट होता रहेगा. तो ये दो मैसेज तो मेरे पॉलिसी मेकर्स और गवर्नमेंट के लिए हैं. जनरल पब्लिक के लिए दो मैसेजेस. हमारे यहाँ जो डेटा है लगभग 50,000 आई कलेक्ट होती हैं पर ईयर, which is 0.5%, 1 in 200 of the deaths which take place in the country. 200 लोग मरते हैं, उनमें से खाली एक की आंख डोनेट होती है.
बिल्कुल सर, बिल्कुल.
और भारत में हमें कम से कम 2.5 लाख कॉर्नियल ट्रांसप्लांट करने की आवश्यकता है, ताकि हम जो बैकलॉग बढ़ता जा रहा है ना, जितने आप ऑपरेट करते हो ऑलमोस्ट उतने ही नए कॉर्नियल ब्लाइंडनेस ऐड होते, तो नंबर तो कम नहीं हो रहा. तो आपको 2.5 लाख कम से कम करने हैं प्रति वर्ष कॉर्नियल ट्रांसप्लांट. वो कब होंगे? थोड़ा सा बढ़ाना पड़ेगा. 40 लोग मरे तो एक अगर आंख डोनेट कर देना, और एक आंख डोनेट करने वाले से 2 लोगों को दृष्टि मिलेगी. तो ये हमें जनरल पब्लिक के लिए मैसेज है कि मेक श्योर यू डोनेट योर आईज. इवन इफ यू हैव नॉट डोनेटेड योर आईज, आपके परिवार में किसी की मृत्यु होती है तो आप एज ए फैमिली मेंबर कैन कॉल द नियरेस्ट आई बैंक. दे विल कम एंड कलेक्ट आईज and use it for eye transplant, eye donation. These are the 2 messages I have for general public, and earlier 2 messages for policy. Thank you, Dr.
Thanks a lot, sir. And it is a very, right message for during this National Eye Donation Fortnight. And I may tell you, being an ophthalmologist, I was also looking after the National Program for Control of Blindness. And 2015, we launched this program, and we cleared all the backlog of this corneal blindness, especially the bilateral blind. They were all operated with the help of the private surgeons, private hospitals, because you can't leave them alone, right? So private doctors, they need to be involved, because most of the surgeries are performed by the private doctors and the private hospitals. So that is another important thing. I think I must mention this. And thanks a lot, sir, for being with us and sharing your rich experience with us and with all the private, with the public health specialists who will be watching this video. So we'll be formally launching by tomorrow or day after tomorrow. I think we'll be launching this formally. So after editing, and thanks a lot, sir. So over to Dr. Sonu, sir, for concluding.
Yes, so I think it was always a treat listening to Dr. Sanjiv Kumar whenever he is part of our international public health leadership program, management programs, and other programs. So it's always a treat, and he has given I think, very key public health skills, which are really important for people who are practicing public health. And as rightly told, that the leadership should be inculcated and should be imbibed among all, and the formal leadership trainings is must for everyone, including our clinicians, including public health practitioners, and other people who are actually involved in dealing with public and dealing with making policies and practice. So thank you very much, sir, for being part of this leadership talk. And we look forward to inviting you again for many other issues. Thank you, sir.
So thanks a lot.
Thank you, Dr. Sonu Goel. Thank you, Dr. Rakesh Gupta. Thank you, sir.
Thank you, sir.
And look forward to continued working with you. Thank you.
Thank you, sir.
Hello and welcome to DocPlex's Health Minute. The National List of Essential Medicines will be released soon with an updated list of medicines which the manufacturers are required to sell at a price equal to or lower than the ceiling price as per government norms. Emirates Health Services has launched free dental services for its citizens to ensure sound oral and dental hygiene to prevent complications and facilitate general health and quality of life. These services are dedicated specifically to the elderly and the people with disabilities of the region. The Health Ministry of Japan has approved a combination of silgavimab and tixagevimab as a preventive treatment for COVID-19 infection and has also given consent for booster shots for children between 5 to 11 years of age. A study suggests that tecovirimat is safe and effective for the treatment of symptoms and skin lesions associated with monkeypox. The CDC also allows compassionate use of this drug for adults and children with orthopox viral infections, including monkeypox. The Federation of Obstetric and Gynecological Societies of India has collaborated with the National Accreditation Board for Hospitals to strengthen the health system for safer childbirth, improve maternal healthcare services, and reduce maternal mortality in India. What should the focus of this collaboration be to improve the quality of maternal healthcare in India? Share your views by commenting below. For the latest medical updates from across the globe, stay tuned to DocPlex's Health Minute. Happy DocPlexing!